A very good evening, everyone. Today, my paper presentation in Sonobuzz 2026 is on case-based spectrum of congenital heart diseases in neonates evaluated for 2D echocardiography. My co-author for this paper presentation is Dr. Y.P. Sachdev sir, Professor and HOD of Department of Radiodiagnosis at Dr. BVP Rural Medical College, Loni. To start with, congenital heart diseases are the most common congenital anomalies in incidence of 8 to 10 per thousand live birth, with 25 to 30% of the congenital heart diseases are critical, requiring intervention in the neonatal period itself. They present usually with cyanosis, respiratory distress, poor feeding, and shock line collapse features. On 2D echocardiography with color Doppler is a gold standard for diagnosis, for early diagnosis, anatomical delineation, as well as hemodynamic assessment for the same. Aims and objective for this study is to evaluate on the spectrum of congenital heart diseases in the neonates. Out of 112 neonates diagnosed with congenital heart diseases of the 2D echocardiography were included. Premature infants with PDA and acquired heart diseases were excluded from the study. Using 2D echocardiography with Doppler in the machines Toshiba Zario 100 as well as on the GE Logic Vivid T8 machines we have used for the 2D echo in tertiary rural care hospital setting to identify and classify the congenital heart diseases in neonates up to 30 days of life. Methodology and approaches used for neonates from 0 to 30 days of life referred from the NICU or the postnatal ward. Evaluate using the segmental echocardiography analysis, color Doppler, and spectral Doppler analysis. For common acyanotic heart diseases, critical cyanotic heart diseases, as well as complex congenital heart diseases. Acyanotic congenital heart diseases which were there. Case 1 is atrial septal defects, ASD. Patient neonate came with on day 7 of life, term neonate with asymptomatic usually, and came up with soft systolic murmur which were innocent murmur. On 2D echocardiography, there were ostium secundum defect on the interatrial septum with left to right shunt on color Doppler study. With normal AV and VA connections, no pulmonary hypertension was seen on the echocardiography. Case 2 is ventricular septal defect. Day 10 of life neonate came up with tachypnea during the feeds with mild feeding difficulty, systolic murmur as well. On 2D echocardiography, there was mid-muscular VSD noted with left to right shunt on color Doppler study, with no pulmonary hypertension noted in the patient on the 2D echocardiography. Patent ductus arteriosus patient. Day 4 of life came up with tachypnea, bounding pulses, wide pulse pressure as well. On 2D echocardiography, there was persistent ductal flow noted between the aorta and the pulmonary artery with continuous left to right shunt, and left atrium and ventricle show volume overload on congenital color Doppler study. Cyanotic congenital heart diseases which are critical in the origin. First one is tetralogy of Fallot. Baby came on day 3 of life on an ICU with central cyanosis and low oxygen saturation, unresponsive to oxygen therapy. On 2D echocardiography, there was large subaortic VSD noted with overriding of aorta. RVOT obstruction was noted as seen, with hypoplastic pulmonary artery as seen on the short axis parasternal view noted, with reduced pulmonary blood flow as well on the short axis parasternal view. On the transposition of the greater arteries, the case 5. Baby on delivery on day 1 of life with severe cyanosis within the hours of birth, no response to oxygen therapy. On 2D echocardiography, there was aorta originating from the right ventricle, as we can see on the long axis parasternal view, with pulmonary artery from the left ventricle, arising from the left ventricle, here on the long axis parasternal view as we can see. On the suprasternal view, there is parallel great vessels noted, which is a typical sign of a DTGA. Survival depend on the intercirculatory mixing as if there is any septal defect present. Total anomalous pulmonary venous circulation, case 6. Baby on day 2 of life, neonate, progressive central cyanosis with severe respiratory distress, tachypnea and subcostal retractions was noted. On 2D echography, there was absence of pulmonary venous drainage into the left atrium. with turbulent flow noted on the site of anomalous pulmonary venous drainage. As we can see in the images, we are suspecting here as a vertical vein as a pulmonary anomalous vein, which is drainage for the remnant circulation with turbulent flow. Single ventricle philosophy. On day 2 of life, baby came up with postnatal cyanosis, tachypnea, and weak pulses with low urine output, suggesting low cardiac output or ejection fraction, decrease in ejection fraction. Functionally, single ventricle was seen with hypoplastic or non-visualization of the second ventricle as seen. Mixing of the circulation was noted, which is a clinical sign for the cyanosis. AVSD patient with on case 8, we can see case 8 as day 10 of life, baby with poor feeding, with early heart failure sign, with weak pulses and low urine output patient. As we can see, there is common AV valve with hypoplasia of the AV valves as well, and significant regurgitation noted on the AV on the color Doppler study. Here on the long axis parasternal view as well as on the subcostal view as well. Congenital aortic stenosis, day 3 of life, poor feeding, lethargy, episodes of tachypnea was there in the baby with early signs of heart failure. On 2D echocardiography, there was reduced systolic opening of the aortic valve with incidental finding of the bicuspid aortic valve as seen on the short axis parasternal view. With narrowed left ventricular outflow tract on long axis parasternal view as well. Case 10 is coarctation of aorta. Day 5 of life with tachypnea and episodes of cold extremities, and BP on examination was upper limb shows higher side of BP as compared to the lower side, with discrete narrowing of aortic isthmus and turbulent flow on the narrowed aortic segment as seen on the suprasternal view. On the congenital heart disease, which shows heterogeneous and often subtle clinical features, which converts the symptoms into the precise anatomical diagnosis. The critical cyanotic and obstructive lesions were TAPVC, corrected TGA, coarctation of aorta. Out of 112 neonates diagnosed with CHT on 2D echocardiography were included, out of which male neonates were 61 and female were 51, showing the ratio of 1.2:1 with male to female ratio. Acyanotic heart disease were 87.5%, while the cyanotic heart disease was 12.5%, with majority of the acyanotic heart disease were the ventricular septal defect, while the majority of the cyanotic heart diseases were the 50% of the tetralogy of Fallot patients. Here are my references used on the for the study. Thank you.